Thank you, Madam Speaker. As I reflect on 2025, I stand proud of the advocacy and work undertaken on behalf of the Orange electorate and the people of New South Wales. Concerns raised by clinicians about delays in recategorisation of cancer surgeries at Orange Health Service demanded urgent action. I called publicly and in Parliament for transparent, independent investigation because administrative targets must never outweigh clinical judgment. No cancer patient should face delays to a bureaucratic pressure. I pressed the government for clarity on surgical capacity, waiting times and specialist staffing across breast cancer, urology and vascular surgery, and I acknowledge the Health Minister for responding swiftly, commissioning both an internal investigation and an independent review. A central pillar of my advocacy this year has been pushing for the installation of a Da Vinci surgical robot at Orange Health Service. Through formal motions in Parliament, I've highlighted the clear benefits of robotic surgery, greater precision, minimally invasive procedures, shorter recovery times, fewer complications and better outcomes for patients. A robust business case already exists, demonstrating the need to bring regional surgical capability in line with metropolitan standards. This advocacy is about equality and equity, ensuring Central West patients can access modern surgical care close to home. It is also about workforce. Advanced equipment attracts and retains specialist surgeons, particularly in urology, where regional workforce pressures is acute. As a result of my sustained lobbying, Western New South Wales Local Health District has agreed to reassess the viability of delivering robotic surgery through its new clinical services plan. This is long-term reform, but I remain steadfast. Regional patients deserve cutting-edge care like those in the city. Madam Speaker, transport and regional infrastructure also remained major priorities, and after sustained advocacy, I was able to secure a significant breakthrough. $2 million from the New South Wales Government commitment to plan a passenger train stabling facility in Orange. This is an important step towards restoring daily return passenger rail services between Orange and Sydney and improving reliable transport links across the Central West. This year I continued championing virtual fencing, including through debate on the Prevention of Cruelty to Animals Amendment Virtual Stock Fencing Bill. This work contributed to the New South Wales Government agreeing to legalise virtual stock fencing. Using GPS-enabled collars to contain livestock without physical fences, virtual fencing offers major benefits: reduced fencing and maintenance costs, improved pasture management, real-time animal monitoring and increased farm safety. This reform will modernise livestock management in New South Wales and provides producers with a more efficient and sustainable tool for the future. It will be an absolute game changer for the industry. Recovery from the devastating Central West floods has remained one of my highest priorities. As both the local MP for many of the communities affected and chair of the Central West Community Leaders Forum, I continued working closely with councils and local leaders to push for fair, sustained investment, particularly for damaged water and sewer infrastructure, essential to long-term resilience. This lobbying resulted in more than $20 million in funding for Parkes, Cabonne and Lachlan Shires, and I've also closely monitored the implementation of recovery programs, including the Resilient Homes program, to ensure assistance reaches those most in need and that rebuilding strengthens communities against future disasters. Madam Speaker, mental health has remained an important area of focus, particularly regarding decisions of the Mental Health Review Tribunal, or the MHRT, relating to forensic patients. And throughout 2025, I've raised concerns that too many tribunal decisions appear to favour patients' liberties over the safety and rights of registered victims in the broader community. In Parliament, I moved an amendment to the Mental Health Legislation Amendment Bill to require electronic monitoring, such as GPS ankle bracelets, for forensic patients granted leave. This was about public safety and restoring trust in a system that has long operated with limited transparency. Law and order remain front and centre, and earlier this year I called for a return of 24-hour policing in Forbes. Strong local police presence is essential for deterrence and rapid response. The tragic domestic violence homicide of Forbes' mother, an early childhood educator, Molly Ticehurst, underscores the urgent need for around-the-clock policing to improve response capability. And Madam Speaker, just in final, also mention that there was expansion to palliative care services. The new palliative care expansion will open in January, increasing it to 5 beds, and $21 million for the new operating theatre at Forbes Hospital, which was announced in this year's state budget. Thank you, Madam Speaker.